Welcome to the Digital Health Update. Good evening, everyone. My name is Donna Harding. I will be expanding on our previous speaker's subject of digital health this evening. I am part of the digital health team here at WAFA, and we support not only general practice, but all associated healthcare providers with their digital tools for their respective services. Tonight I'm talking about My Health Record, namely shared health summaries, event summaries, and pathology and diagnostic imaging reports. So what are the national expectations? Ideally, every patient should have a shared health summary. So we will start by talking about the benefits associated with uploading a shared health summary. So as you can see listed here, you've got enhanced patient care, improve continuity of care, informed decision-making, lowering risk of adverse events, minimizing test duplication, and reduce clinician admin burden and increased efficiency. So WAFA's digital health team works alongside the Department of Health and the Australian Digital Health Agency to support healthcare providers in the use of their digital tools. So the rationale for the implementation of My Health Record nationally was to stop siloed information and to have clinically relevant information at your fingertips. GPs and more broadly general practice are only one part of that clinical journey. So the shared health summary and event summaries are very important pieces of information that other healthcare providers would find of value to support them in their own clinical decision making, as they share the same patients, although during a different part of their healthcare trajectory. So just a reminder, here in the graphic at the top of the page, you will see that the percentage of healthcare providers that are actually connected and using the My Health Record system. We have 99% of general practice registered and using nationally, and you will see on the far right of the graphic that other healthcare providers, such as aged care, who are also being supported to now get connected to My Health Record. So clinicians working within those residential care homes will also be looking for this highly valued information about patients who are also now under their care. So as we speak, the next stage of My Health Record rollout is also getting underway, and this involves allied health services. So they will also, as they become registered and connected, will also be looking for that very valued piece of information, so shared health summaries and event summaries, which will support their clinical decision making. So just a reminder, the shared health summary actually contains a list of the medical conditions, so a list of all the comorbidities, a list of medications that have been prescribed, a list of known allergies, and immunizations, which of course will filter through to My Health Record via air as well. So another My Health Record function for general practice is an event summary. So this can be uploaded post-consult if the information is determined to be clinically relevant for other healthcare providers, as mentioned, who are also looking after this same patient. So who is looking at this information that general practice upload? Which other healthcare professionals will find this information valuable? So you have specialists, pathology providers, hospital emergency clinicians, aged care clinicians, allied health, pharmacy, etc. So you can see here on this pie graph on the right-hand side of your screen how many patient records are being accessed by other healthcare professionals who are also looking for this information. And this was recorded in just the first half of 2025 alone. So if we refer back to the benefits mentioned previously, which were enhanced patient care, improved continuity, etc., we understand that having missing information can potentially be a real problem. So one way to mitigate the risk of not having data available, which will inform your clinical decision making, is to enhance your workflow. So how do we ensure that we meet national expectations around every patient having a shared health summary uploaded and support realisation of those benefits previously mentioned? So here are some suggested clinical milestones that you may be able to use as a guide within your practice to support the potential increase of uploads of information. So it could be during chronic condition management plan, during an aged care assessment referral, during creation of a mental health management plan, a referral to a specialist, development of a palliative care plan, after a comprehensive medical assessment, so CMA, within aged care, and also that 75 plus health assessment. These all could potentially be triggers to see whether there's a current shared health summary, and if not, we can take the opportunity to upload one then. But if you can think of any more episodes of care that will benefit inclusion into your workflow, it would be a worthwhile discussion. We have in draft a clinical considerations guide on when to upload to My Health Record, which we will be happy to share with you if you feel that would be useful. So you may ask, does a shared health summary have to be uploaded every single time one of these milestones occur? The answer is no, only if a diagnosis has changed and or a medication has been introduced or removed. You do not need to upload a new shared health summary if the patient is placed, for example, on short-term medication like antibiotics. However, this may be a good opportunity to instead upload an event summary which captures this episode of care. So the next topic I will touch on, once again, which is also My Health Record, but specifically is the My Health Record pathology and diagnostic imaging new rule. So currently, pathology and diagnostic imaging reports can be uploaded by those providers who choose to participate in My Health Record, and I want to emphasise on my point of who choose. The landscape is now changing as there is a new health legislation amendment which is modernising My Health Record sharing by default. It's a bill of 2024 and it has been passed in the Australian Parliament on the 13th of February this year, 2025, which states all pathology and diagnostic imaging providers nationally must register for My Health Record and must set to upload by default. Here in WA, we have Infinite Path and Pathwest, so expect more providers to become connected in this space moving forward. This new rule, however, is yet to be mandated, so just listen out for any changes and we're happy to share the information as it comes through. My last topic is regarding the existing 7-day lockout rule for consumers. The Australian Digital Health Agency is currently considering an amendment of the current policy. So what does this mean? It means patients or consumers will have access to the pathology and diagnostic imaging results the same time the clinician does. And again, as we hear news of developments in this space, we will keep you abreast. And if there's any resources that become available for your practice that could be passed on to consumers, we will be sure to make sure that we include you in that information, where it's kind of like just letting you know that that conversation is taking place. There is nothing concrete at this time, but just keeping you informed. So that's it from me, and if you have any questions on any of these topics, please do not hesitate to reach out. Thank you.